Hello everyone. In this video, we will be studying about the named fracture and these are commonly asked in the orthopedic section. So first of all, we are studying upper limb fractures. In the upper limb, first is mallet finger. Mallet finger is linked with the extensor tendon rupture and the one that is related is jersey finger. Jersey finger is related with the flexor digitorum profundus tendon rupture. So how we will remember the jersey? Jersey is a full sleeve sweater. So jersey is linked with the flexor tendon rupture and the opposite one, the mallet, will be with the extensor tendon rupture. Then next we have gamekeepers or skier's thumb. Gamekeepers or skier's thumb is related with the ulnar collateral ligament and at the metacarpophalangeal of the thumb from the proximal phalanx. So ulnar collateral ligament is damaged and it is avulsed from the proximal phalanx. Then we have Bennett and Rolando. Bennett and Rolando both are linked with the thumb. So Bennett T is coming thumb related to thumb and it is intra-articular thumb and first metacarpal. That is first metacarpal fractures are these. So in the Bennett it is simple, we have to learn that it is intra-articular. But what is special in Rolando? Imagine the Rolando standing with the legs wide open in the football ground. So Rolando is Y-shaped fracture. Rolando is Y-shaped and Bennett is intra-articular thumb fracture. Then we have Barton's fracture. In Barton's also AR is coming, so it is intra-articular fracture, but Barton is of distal radius. So Bennett and Rolando were linked with the thumb, while Barton is linked with the distal radius. And Schoffer or Hutchison fracture. Schoffer or Hutchison fracture is linked with the styloid process of the radius. Barton's intra-articular distal radius and Schoffer or Hutchison styloid process of the radius. Then we have Boxer's fracture. Boxer's is linked with the fifth metacarpal. Boxer's fifth metacarpal. Then we have Colles fracture. Colles C is next followed by D. So Colles is dorsal tilt and Smith. Smith is ventral tilt. These both are distal radius fractures. Colles is dorsal Smith. Smith also known as reverse Colles and it is ventral tilt. Then next we have Monteggia and Galeazzi. Monteggia and Galeazzi, how will remember? By the mnemonic MURGA, Murga. So Monteggia is linked with the ulna and Galeazzi is linked with the radius fracture. So Monteggia is proximal ulna plus radial head dislocation. That is, radial head is located proximally in relation to proximal ulna. So proximal ulna plus radial head dislocation. While Galeazzi is distal radius and drudge, that is distal radioulnar joint disruption. Distal radius and the distal radioulnar joint disruption. So Galeazzi, in the Galeazzi Z is coming, so it is related with the distal things. Then Monteggia A is coming, it is related with the proximal things. And Galeazzi is also known as Piedmont fracture. Then is nursemaids or Malagnay subluxation. Nursemaids or Malagnay subluxation is subluxation of the radial head out of the annular ligament. The radial head is dislocated out of the annular ligament. Then we have Essex loprasti. Essex loprasti is linked with the in loprasti R and T both are coming. So R is for radius and T for twisting force. So radius twisting force is applied, then the radius head would be fractured, interosseous membrane will be ruptured and drudge, that is distal radioulnar joint, will be disrupted. So from the elbow to the hand we are studying the injury from the elbow radius head, then in between interosseous membrane and the at the hand distal at the wrist level distal radioulnar joint is disrupted. So all the three things are disrupted, that is Essex loprasti. And if the similar thing happens in the lower limb in respect to the lateral bone, that is fibula, then it is mesonavy. So the analogous is mesonavy of the Essex loprasti. So we are done with the upper limb fractures. So let's revise again quickly. The upper limb, mallet is extensor tendon, jersey finger is flexor tendon, gamekeeper skier's thumb, ulnar collateral from the proximal phalanx and MCP thumb. Bennett Rolando intra-articular thumb, Barton intra-articular distal radius, Schoffer Hutchison styloid process of radius, Boxer's fifth metacarpal, Colles ventral, Colles is dorsal tilt, Smith is ventral tilt. Both are of distal radius. Then we have Monteggia is linked with proximal ulna and radius head dislocation. Glaze is linked with distal radius and drudge dislocation, also known as piedmonts. Nursemaid or maligne is radial head out of the annular ligament. Essex loprasti, radius head fracture, interosseous membrane, and drudge. Now we come to the lower limb fractures. In the lower limb, dashboard injury. As we know, dashboard injury, the posterior dislocation occurs. So posterior dislocation of hip plus fracture posterior lip of the acetabulum. Then is open book. Open book is anterior-posterior compression of the pelvis and pubic symphysis is disrupted. So if the pubic symphysis disrupt, then the pelvis will look like the book is open. So open book fracture. Then is maligne. Maligne is M for maligne, M for male. Male means similar side. So side to side compression, fracture of the pelvis and the fracture of the pubic rami anteriorly and fracture of the sacroiliac joint posteriorly. So if same sided fracture of the pubic rami and sacroiliac joint, then it is called maligne. And if the bucket view, like two persons are holding the bucket, so they will be holding from the opposite side. So bucket handle fracture is opposite side fracture. Same pubic rami and sacroiliac joint, but on the opposite side. Then POTS, P is converted into B. So POTS is bimalleolar. C is third letter. So cotton is trimalleolar. Pot bimalleolar and cotton is trimalleolar. Then is Hoffa's fracture. Hoffa's fracture is fracture condyle of the femur in the coronal plane. Then we have bumper fracture. Bumper fracture is tibial plateau fracture, and it is hit like bumper hits the person that is walking on the road and hit on the lateral side, to tibial plateau can be fractured. Then we have runner's fracture. Runner's fracture is stress fracture of the distal fibula. Imagine a feeble person runs, then he will have fracture. So feeble person means fibula fracture in the runner. Then pylon's fracture. Pylon is I and N is coming. So intra-articular of the distal radius, distal tibia. Pylons is intra-articular of the distal tibia. In the radius, we have done Barton's fracture, Bennett's and Rolando in relation to thumb. So pylon in the tibia. Then Tilloch's fracture. Tilloch's is anterior tibiofibular ligament and it is tibial margin. If it is occurring on the tibia, this we have discussed in the images section of the orthopedic also, if you want to see the diagram. So Tilloch's is anterior tibial margin of the anterior tibiofibular ligament. And if it is Wagstaffe, that is F is coming, then it is linked to the fibula. So anterior tibiofibular ligament. Tibial margin, Tilloch's fracture. Then is aviator. Aviator fracture is linked with the talus. And talus we had classification, that is Hawkins classification. Then we have Lever's or Dongenou's fracture. Lever or Dongenou's fracture is linked with the fracture calcaneum. And in this, the two angles are there. One is Ghisane's angle and one is Bowler's angle. So how I'll remember this? The mnemonic for this is Lever's fracture, like Anushka is lover of Virat. So Anushka will have a fracture on her calcaneum when she jumps into the ground. And with the Virat, we angles are linked. Virat is Gisna means Gisane means Gisna, like Gisna the ball, and ball is for bowler's fracture, and bowler's angle is on the back of the calcaneum, while Gisane's will be towards the upside. This also we have discussed in the images section. Then we have Chopard's fracture. Chopard is intertarsal joint and Lisfranc is tarsometatarsal joint. So Chopard is the more proximal one. C is the first letter and followed by L. L is tarsometatarsal, the more distal one. Then is Jones fracture. Jones is fifth metatarsal. Fifth metacarpal, we had Boxer's fracture. Fifth metatarsal, we have Jones fracture. And March fracture. March fracture, like in military people, second or third metatarsal. And basically, second metatarsal is most common and it is linked with the neck of the second metatarsal. March fracture. So let's revise again quickly the lower limb fracture. Dashboard fracture, posterior lip of the acetabulum and posterior dislocation of hip. Open book, anterior-posterior compression of pelvis. Pubic symphysis disrupted. Maligne is same-sided. Bucket handle is opposite-sided. Pubic rami and sacroiliac joint. Pot is bimalleolar. Cotton is trimalleolar. Hoffa's is coronal plane, fracture of the condyle femur. Bumper, fracture tibial plateau. Runners, fibula, Distal fibula stress fracture, pylon intraarticular of distal tibia, talux, anterior tibiofibular ligament, tibial margin, aviator talus, lower donjonus, that is calcaneum, chopard's intertarsal, Lisfranc tarsometatarsal, Jones fifth metatarsal, and March second or third metatarsal. And one another fracture which I have not mentioned here is nutcracker fracture, that is fracture of the cuboid between the fourth and the fifth metatarsal bone. Nutcracker is linked with the cuboid. Cuboid. Then next we have spine. The spine fractures. So first is Jefferson's fracture. Sun is coming, so sun 1. It is rhyming. So 1. C1 vertebra burst fracture is Jefferson's fracture. Chance fracture is horizontal. Burst fracture is vertical. So chance fracture horizontal. Burst B for and V vertical. Then hangman's fracture C2. Hanging and also seen in RTA, hangman's fracture. Then is Clay-Shawler's. Clay-Shawler's cervical, C for cervical, L for lower, and S for spine. So lower cervical and upper thoracic spinous process can be injured in the Clay-Shawler's. Then motorcyclist hinge fracture, that is base of skull fracture, and the skull is divided into anterior and posterior parts. The diagram has been discussed in the forensic section. So motorcyclist hinge fracture, Clay-Shawler's lower cervical and upper thoracic spinous process, hangman C2, then Jefferson C1, chance is horizontal, burst is vertical. So that were all the named fractures I have discussed in this video. I hope you will be able to solve many questions from this topic. So if you like my content, please do subscribe my channel. Thank you.